Welcome to Radi Us, our University of Manitoba Radi Faculty of Health Sciences monthly podcast, where you get to catch up on the headlines from the past month and meet our faculty, staff, and learners making news. We'll also be engaging with our Radi community beyond our campuses, so be sure to listen for alumni and partner voices too. The Roundup for the month of October 2025 includes stories about the generosity of dental hygiene students, how is keeping an HIV program in Kenya running in the wake of funding cuts, and how scientists have understudied women's brains, and more. I'm Jonathan Wilson from the Radi Faculty Communications and Marketing team. Dr. Joanne Unger donned a cape and became a superhero for a day. She wasn't fighting crime. Instead, she was raising money for the Department of Clinical Health Psychology's new endowed professorship in child psychology. Unger is an assistant professor of clinical health psychology at the Max Rady College of Medicine and the specialty lead and section head, Child and Adolescent Service Clinical Health Psychology at Shared Health. She took part in the Children's Hospital Foundation of Manitoba's Suspended Superheroes event on October 3rd. Dressed as Batgirl, she rappelled down the side of HSC Children's Hospital 5 times. Unger said that the first time going down the building was terrifying.
But after you're out there, you're looking up. So you're just walking backwards down a building. So it's really just the getting off that's challenging when you're looking down and you're, trying to talk your body into coming off the roof. That's the hard part.
At each floor, she waved to children gathered at the windows to get a glimpse of their favorite superheroes. The new endowed professorship in child psychology will protect up to 50% of a faculty member's time for research. This will double or triple the time that professors in the department might be able to direct to their research.
And I thought, well, what a great way to launch our fundraising efforts to have the lead of the Child and Adolescent Clinical Health Psychology Service rappel down a building to start the fundraising efforts for a child psychology professorship.
Unger's superhero effort raised more than $10,000 for the new professorship. Joyce Adhayambo has lived with HIV for the past 24 years, and she depends on antiretroviral drugs to keep her alive. She was shocked when she found out that the United States President Donald Trump's administration was cutting the sex worker outreach program's $1.6 million in funding. The University of Manitoba has helped operate the sex worker outreach program, also known as SWAP, since 2008. The program provides Adhayambo and thousands of other people in Nairobi, Kenya, with antiretroviral drugs, also known as ARVs, to treat HIV.
Without ARVs, some of us will definitely die. The support that University of Manitoba is giving us has really gone a long way to keep us alive.
Adhayambo was in Winnipeg for meetings at the end of September with 3 other SWAP peer leaders and Dr. Joshua Kimani, the physician in charge of the program. Dr. Keith Folk is a professor and department head of medical microbiology and infectious diseases at the Max Rady College of Medicine. Folk said and the Rady faculty are providing financial support to put a temporary plan in place to keep the program running after the loss of aid at the end of September. Folks said the emergency funding will allow them to keep 5 of the 10 clinics open with a reduced staff. The SWAP team is currently working to secure funding to reopen all the clinics.
Hitting on every front that we can, from philanthropy to research grants to clinical trials to speaking to manufacturers and others for donations. So it's going to take a number of different fronts.
Adhayambo said SWAP has changed people's lives and it's important it continues to operate.
And the program has also created a safe space for all of us because sex workers is a marginalized community, and when we go to the program we feel safe, we feel secured, and we feel we are in, I say it is a home for some of us.
A recent study has confirmed that smoking is associated with an increased risk of hypertension or high blood pressure. Most previous studies looking for this link have relied on people's self-reported smoking status. The study was different. It used a urine test that detects cotinine, a chemical that is a reliable indicator of tobacco exposure, in addition to asking study participants about their smoking. The results showed that both light and heavy smoking, as measured by both the urine test and self-reporting, were associated with an increased risk of high blood pressure. The researchers found that some patients underreported their smoking. They suggested that routine lab tests for cotinine could help doctors get a more accurate picture of patients' exposure to nicotine. The study was led by Dr. Setor Kunachor, a professor of internal medicine who holds the Evelyn Versakovsky Research Chair in Cardiology in the Max Rady College of Medicine. On CBC's Radio Noon Manitoba, he was asked whether inhaling secondhand smoke also raises the risk of high blood pressure.
We didn't look at that, but then when you are exposed to secondhand smoke, your cotinine levels can actually go up. So that's one of the reasons why we actually advocating that there should be routine testing of urine or blood to help doctors to get a clear, objective picture of your exposure to environmental tobacco smoke. Because you could be a non-smoker, but still be exposed to tobacco smoke, which could drive your risk of developing hypertension.
Mm-hmm.
The study findings were published in the Journal of Human Hypertension. Members of the dental hygiene class of 2025 sold so many cupcakes and cookies at bake sales to raise money for their graduation celebration that they wound up with extra funds. When the group realized it had a surplus of $3,400 from all the different fundraising activities, the graduating students decided to donate the money to the School of Dental Hygiene's Patient Support Funds. Dental Hygiene Class of 2025 President Lexi Mueller-Morin said the group felt compelled to donate because of their excellent experience in the program.
The influence of our direct instructors and supervisors, I think they really instilled in us the importance of giving back and being able to advocate for our patients.
The donation will go towards 2 patient support fund initiatives, which help those who don't have access to public or private dental insurance and aren't able to pay out of pocket. Smiles for Miles helps newcomers and refugees, and DH4U enables dental hygiene students to advocate for their patients and make the case to help cover the cost of their care. Mueller-Morin said her class thought it would be great to give back even though they only graduated in May.
I think we just felt it'd be good to start early, really, right? It's kind of like, okay, you know what? We can make this impact now. Why don't we do that? And I think it's just going to help encourage all of us in the future to do so.
More than 260 students from the Rady Faculty of Health Sciences gathered at the University of Manitoba's Bannatyne campus on October 16th for an interprofessional education event focused on collaboration across healthcare disciplines. Undergraduate students from the Max Rady College of Medicine, College of Nursing, the College of Pharmacy, and the College of Rehabilitation Sciences took part in activities designed to build skills in collaborative leadership, teamwork, and relationship-focused care, with an emphasis on the person receiving care. Students from the University College of the North in The Pas and Thompson also joined online as part of UM's nursing education partnership with the Northern Institution. Vladin Prodiger, co-lead of the event, explains why collaboration matters in healthcare.
Healthcare is complex. There's not enough healthcare providers, physicians, nurses, so it's really important in team-based care to emphasize that roles sometimes overlap in their positive aspect and also some negative aspect in terms of confusion and lack of clarity. But it's really important to determine, because of the scopes of practice overlapping and oftentimes increasing, who is in the best position in a team to do what and what would benefit the person receiving care the best in that specific context. So it's really important that students are flexible in their approaches to delivering care and negotiate the roles and see who is in the best position based on the skill set and training to provide the care for the person in need.
Fourth-year pharmacy student Sophia Abio shared her perspective on the experience.
I think these activities are an essential part of our learning, especially as healthcare professional students. It's one thing to be an expert in our own fields, but it's another to also understand the expertise of other people in your team, and as well how you communicate with each other as well as with your patients. These are important skills that we need to know before entering the field. So very appreciative we have these.
Most medical research is conducted on men, and that negatively affects women's health, experts said at a recent symposium on the Bannatyne campus. The field of neuroscience has a particularly male-centric track record, guest speakers said at the Equity Symposium. The event was held on October 30th by the campus organization WISDOM, which stands for Women in Science, Development, Outreach, and Mentorship. Dr. Jennifer Rabin is a clinical neuropsychologist, scientist, and a faculty member at the University of Toronto. In her presentation, she said that over the past 50 years, neuroscience has exploded with discovery, but most of this research has been carried out on the male brain through the study of male cells, male lab animals, and male human participants. Rabin said only a tiny number of brain imaging studies have been performed in relation to women's experiences, such as pregnancy, menopause, and hormone therapy.
To put it into context, we know more about the Egyptian pyramids than we do about women's brain health. We know more about LeBron James's off-season diet than we do about women's brain health. And we also know more about the surface of Mars than we do about women's brain health. So I argue today that this narrative must change, and it starts with all of us.
Rabin spoke about Alzheimer's disease, noting that nearly 2/3 of people with the disease are women, and research is needed to know how menopause appears to play a part in its development. She said she is happy to see the drug lecanemab approved in Canada for early-stage Alzheimer's, but the fact that it slowed cognitive decline by 43% in male patients and only 12% in female patients was buried in the supplement material of the key research paper. Thanks for joining us today. Ready Us is heard monthly on the UMFM 101.5, and all episodes are available for stream on Spotify, Apple Podcasts, and YouTube. Please send us any ideas and feedback to radymarketing@umanitoba.ca. Read more about this episode's stories by reading the show notes or visiting our UM Today Rady Network news site at news.umanitoba.ca/network/Rady Faculty of Health Sciences.